So we've got some developing news, literally just as we have been on the air here a couple of minutes ago. A spokesperson for Senator John Fetterman says he has been discharged from the hospital. So he is out of the hospital, the Pennsylvania Democrat, set to be back at work on Monday. Senator Fetterman has been spending the last couple of nights at a hospital here in Washington after feeling lightheaded earlier this week. He was tested over the past couple of days to see if he had potentially had a second stroke. He was monitored for seizures. His spokesperson is saying all those tests have come back normal. Remember, Senator Fetterman had a stroke when he was on the campaign trail last year. So this health scare is renewing some questions about how he's doing, transparency, et cetera. I want to bring in now Vitali. And Ali, Senator Fetterman still has auditory processing issues from that stroke. It is obviously significant and good news that he is out of a hospital, that apparently doctors have ruled out a stroke, seizures. He's okay to come back to work.
Yeah, and in a tweet, his spokesman says that he's going to be back in the Senate on Monday. And so that is good news in terms of his overall health, the fact that he can come back to work. They also say in this tweet that just came out in the last 2 minutes that he had a CT, a CTA, and MRI tests done. All of that is what ruled out another stroke, but that also his EEG test results came back normal. So that's how they ruled out any potential for seizures. And you're right, he spent the last 2 nights in a hospital here in D.C. This came on seemingly very suddenly during the Democratic retreat on Wednesday. And as you mentioned, he left when he felt lightheaded, told his staff, they drove him to the hospital. And of course, there's a heightened sense of concern anytime someone who's recovering from a stroke begins to feel those symptoms. Makes sense why he went to the hospital and why they were so keen and clear in their observation of him.
Would it be standard operating procedure in a moment like this, Ali, to release those doctor's notes, that information?
I think that's where this goes next. And it mimics the conversations that were had on the campaign trail, where you want to be sensitive to the candidate, now senator's health. Of course, them doing well is the paramount concern. But it's also then a question, once we establish that they are doing well enough and that he can come back to work on Monday, the question is, how does this work going forward? Can you provide us with some evidence of the fact that the doctors are, in fact, saying this? I think transparency is going to be really important. And look, since he's come to the Senate, this team has been clear about the fact that he has needed screens installed in the Senate chamber, in his hearing rooms, to allow him to understand information, because he needs a little bit of extra help with auditory processing still as he recovers from this stroke. Those accommodations have been made here in the Senate. Now, though, with this latest episode, there is a question of just needing to provide some transparency around it, both in this moment, in the immediate aftermath of him leaving the hospital, and then as things go forward. And there are still continued questions of how is he doing? How is his health?
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.